All right, welcome to another episode of Livingston County's YouTube live question and answer sessions on the COVID-19 crisis, the response, and kind of what's going on in county government. I'm joined today by, my name is Ian Coyle. I'm the county administrator in Livingston County, and I'm joined today this afternoon by Dr. Aaron Farney. Aaron, if you could introduce yourself and tell the audience your role. And
Sure, absolutely. Thank you. So I am an emergency medicine physician. I work predominantly at the University of Rochester at Strong, as well as Noyes Memorial Hospital in Dansville. And I'm also an EMS physician. I work predominantly with EMS here locally in Livingston County.
Great. Before we begin, I do have to make a plug, an off COVID-19 plug here for a second. We are in the middle of a crisis, a pandemic, and the response that necessitates, but we're also in the middle of the census. So I wanted to make a plug for the census and let you know that as of the 13th of April, which was yesterday, Livingston County in the region of an 11 county region ranks, third in terms of the response rates for the census. We'd like to get up to number one. We've got about a 44%. There's at least one county over 50 and one at 45 and change. We're at about 44. So we'd like to see that get up a little bit. So please do that. Important to note, I think you know what the census is out there and what it means and how meaningful it is. But it does, at the end of the day, make funding available on a population basis, pro rata share at times. And some of that funding that comes back is funding for programs and service delivery that we're doing right now on the front lines of the COVID-19 response. So things like Medicare, Medicaid, the nursing home, school lunch program, supplemental nutrition program, highway funding, things like that. So keep that in mind when you consider the census, and I ask that you consider submitting it on behalf of the county. So we are going to begin. So again, this is our third session doing the Q&A. We have asked for questions in advance from the public. We have received those questions, and we have them here in front of us. We're going to go through them one by one. They were submitted in advance by members of the public up through really this morning. So we've had a chance to look at them, and I have them in front of me, so we'll just begin.
Sounds good.
The questions in this Ask the Doctor segment, the first question is from Sue. And Sue asks, what are the most important things that older adults can do to protect themselves at this time?
Absolutely. So that is absolutely a great question. First and foremost, I would say that as with everyone else, stay home to the maximal extent possible. So even with groceries, medications, or other essential services, think about who do you know that can run to the grocery store, pick up your medicines for you, perhaps drop them at your front step so that there's no contact, etc. If you do have to go out in public for any reason, make sure to be efficient, make it a quick trip, minimize the time spent in public places, know where you're going, and sort of have a game plan ahead of time. Bring some hand sanitizer with you. Keep that in your car. When you get back in your car, make sure to wash your hands well. And then secondly, I would add, wash your hands frequently and practice good hand hygiene at home. Avoid touching your face, etc. Thirdly, take your prescribed medicines. So now is more important than ever to take those medicines that have been prescribed by your regular doctors to keep you healthy and well, so that way you can stay out of the emergency department or the hospital. Get plenty of rest as much as possible, stay hydrated, eat well, drink plenty of water, all those things that the doctors always tell you to do, continue to do now. And then lastly, I would say there's a lot of perhaps some boredom right now, having to stay at home. If you're thinking about picking up a new hobby, I would discourage chainsaw carving or anything else that could land you in the hospital. So maybe gardening or bird watching or something like that would be a safer choice.
Good, and I think that the question from Sue there was directed toward older adults, but it would be fair to say that that guidance, it should really go to folks irrespective of age.
Absolutely.
Really. Yeah, so thank you. Good question, Sue. Next question comes from Lynn. Are Livingston County's positive COVID-19 numbers, number of cases, similar to what other small rural counties are seeing and experiencing. And are we doing a good job with social distancing? So I guess the first question for, I can tackle that one, and is our numbers are about the same as far as the percentage of positive to negatives for the total people that test, how many end up coming positive. That ends up being in that 10% range for most counties. We're right around that range as well. As far as social distancing goes, there has been some press on a couple of websites that are out there that try to gauge the social distancing, I guess, how people are doing in each county for social distancing. It's some sort of tracking mechanism that some of these companies are coming up with. I don't put personally a ton of stock into that. That being said, I think it's based on complaint volume, visibility, what we're seeing in the community, what's anecdotally coming back to us from a law enforcement, code enforcement, county perspective. And we're not seeing a ton of that. So we encourage people to keep in line with what social distancing requirements are. What we are seeing just a little bit of, and I know this is not specific to Livingston County, and that is parks. So parks, trails, open spaces, people are kind of flooding them a little bit, and social distancing then becomes a little bit harder to do. So we just encourage people to time those appropriately while they're there, practice the social distancing, and really don't err on the side of, oh, it's okay, we're kind of almost out of the dark. Not at all. We need to keep our guard up. We need to stay vigilant and stay diligent with respect to social distancing. So the next question comes from Michelle. And Michelle asked about testing for antibodies in Livingston County. There's been a lot of news about this, whether or not that's a test that would maybe show immunity, whether or not there could be some growth in the amount of testing ability on antibodies. Doctor, would you comment on that one?
Absolutely. So hot topic right now. So antibody tests are also known as serology tests. And what they do is they check a blood sample for proteins created by the immune system in response to an infection, whether that's a bacteria or a virus. And in this case, the virus that causes COVID-19. So latest information, we do believe that there are some folks who may have had a very mild version of the illness, or who may not have had or been aware of symptoms who've had the illness. And so the idea behind antibody testing would be to test people for that immune response to the virus, letting us know that, yes, you've been exposed to this virus in some fashion. So the serum blood draws would check for that protein that the immune system creates in response to the virus causing COVID-19. The problem is what to do with that information. So as we know, remember this was called novel coronavirus. So it's only been around for about 4 months in humans on this earth. So we don't know a lot about the virus in terms of long-term immunity to it. There has been some evidence that these antibodies are created, but we don't know how powerful they are. We don't know for how long they last, and in turn, how effective that immune response is. So this immunity could be longer term or it could be short term. We just don't know yet. As I said, everything's new, and there's a lot of research being done on this right now. I would caution people that antibody tests are not a replacement or a substitute for social distancing. So I don't think that this is the big thing we've all been waiting for to be able to get back out in public. We still need to practice those good, safe social distancing measures, even as research continues into antibodies.
Oh, great. Thank you. I think that doctor brings up a good point, and that is there's been a lot of talk about how to get past this, how to, what's the other side look like, and how to get to the other side. Absolutely. And that's a combination of additional testing that we're doing right now, the antibody testing, the continued level in some capacity of social distancing, and then in the out periods, I hope it's just out months, I hope it's not out years, an actual vaccine to develop to address this issue. So those are 3 or 4 things that will be done in the context of how do we kind of get back to normal? Antibody testing will be a piece and portion of that. Next question comes from Tracy, and I guess I'll handle this one. It deals with the enforcement side of things. How are mandatory quarantines enforced? And the answer is a local health department does, so our county health department oversees compliance with that. We do twice a day patient checks for monitoring. There is a fine and penalty for folks who don't follow the quarantine process. Right now, we have had, knock on wood, compliance, and we hope that is going to continue, but the enforcement piece is with the Department of Health. There are penalties for it. There's daily check-ins. There's regular contact and communication. So it's not like you wouldn't know what was going on, not sure who to call or what to do. We are in direct contact with you during that process. So very good question. That question comes from Tracy. She has another question. I guess I'll let Dr. Farney try to tackle this one here. An employee at a local retail grocery store had tested positive for COVID-19. Since that person was working prior to testing and before advanced social distancing took place, wouldn't anyone who shopped in that store potentially be exposed to COVID-19?
So absolutely valid concern. This virus, what we know about it is that it is predominantly, by and large, spread by exposure to infected respiratory droplets in close proximity. And by close proximity, we're talking within feet, typically 6 to 10 feet or so. So, and then furthermore, the CDC has gone so far as to state that there needs to be some level of sustained contact in that proximity. And they estimate about 5 minutes. So generally speaking, unless you've had very close proximity with someone for 5 minutes or more, the risk of contracting COVID-19 is going to be low. And I would also add that the health department does do contact tracing with anybody who's tested positive in terms of folks who may have had sustained close contact and reach out to those individuals. I would add that anybody that continues to be concerned that they may have been exposed should do the good things that we're all supposed to be doing anyways, which is self-monitoring for illness, specifically the symptoms related to COVID-19, which just for review are fever, cough, shortness of breath, diarrhea or other GI symptoms, muscle aches, or generally just not feeling well, feeling sick. If you develop those symptoms, contact your primary care physician's office. They know you well, and they can provide specific guidance for you based on your medical history and medical conditions.
Very good, thank you. This other question comes from someone who has some concerns about their child. So this individual writes that my son had gotten sick. He has a history of asthma, sleep apnea. They did call the doctor, and because he didn't have a fever at that point in time, they would not test him. This individual writes that since COVID-19 symptoms can differ in people in age groups, why is there sort of a standard list of questions that someone needs to, or benchmarks that somebody needs to hit before testing is triggered?
Absolutely, good question. So this comes up a lot. Early on in the pandemic, testing was very limited. In fact, when we first started working on this, there was no local testing. Tests had to be sent out, whether that was to the state lab in Albany or Buffalo or where have you. In the interval, there has been increased local testing, most of it in Rochester with some contract labs up there as well. So as the ability to do testing is expanded, so has the ability to expand who we're testing. So initially there was very clear guidance because, for instance, certain labs could only throughput 100 to 200 tests per day. That has expanded, now allowing us to test more folks. Earlier, it was fairly restricted to folks who were hospitalized or otherwise very severely ill. Excuse me. So now I would say that there's been a little bit of a relaxation in the requirements, but it's not infinite. We don't have the ability to run 1 million tests a day locally. So we're still not at a point where we can test asymptomatic people or those who are very well appearing with very mild symptoms who are otherwise able to safely isolate at home. But I would encourage folks with symptoms that are concerning for COVID-19 to contact their primary care physician and seek some guidance. And this changes on a daily, weekly basis.
Sure. And as you've seen, just if you're joining us, my name is Ian Coyle. I'm the County Administrator in Livingston County. I'm joined here with Dr. Aaron Farney. We are talking through some of your questions that have previously been submitted about the COVID-19 virus. A theme throughout a lot of these answers has been the maintenance of the social distancing, the maintenance of just general health parameters, the washing of the hands, the sanitation, the cleaning, things like that, and also calling your physician, making sure those direct contacts are made with your medical provider. Sheila comes in with a question about COVID-19. Sheila is a vegan, and fresh produce is a major part of her diet. How long does it live if it does live on produce? And how are stores keeping fresh produce safe? I have a few comments on this. Any questions or any comments you had before?
Sure. Yeah, so absolutely. So I would say that, according to the CDC and the FDA, there's no known evidence of COVID-19 being a foodborne illness, if you will. So eating or ingesting food, even if it did somehow manage to have COVID-19 on it, isn't necessarily a way to contract the disease. This has not been demonstrated. I would also add that generally speaking, food handlers are going to practice safe measures to keep your food safe, as we always would. And so this is just in contrast to things like norovirus or hepatitis A, which can be transmitted via the GI tract.
I think that sums it up. I don't think I have much to add to that other than there was a comment about washing lettuce with soap, and now she would not want to do that, and I guess would agree with that, that she wouldn't have to necessarily wash her lettuce with soap for 30 seconds. Let's see, I think Barbara asked the next question. It's about folks with high blood pressure. I'm hearing that people with high blood pressure potentially are at a higher risk for getting and or passing away from COVID-19. Does that differ if it's under control? Are you really at more of a risk with blood pressure? Will that lower your risk if you've got it under control? Doctor, what are your thoughts on that?
Yeah, so lots of good questions. I would say that first off, there is some truth to comorbid conditions. So high blood pressure, diabetes, heart disease, kidney disease, and any intrinsic lung disease, so asthma, COPD, and what have you, being increased risk factors for outcomes from COVID-19. So with that said, each individual has to take their own entire health picture into perspective. So the relatively healthy person who only has high blood pressure, which is well controlled because they're taking all of their medications as prescribed and following up with their doctor on regular visits, is probably at less risk for a severe outcome than someone with 15 or 20 medical problems that are poorly controlled. So it's really sort of that combination. So I don't want anybody to be particularly concerned about having one disease, especially if it's well controlled. The second thing I want to emphasize is, while there is some truth to high blood pressure being a risk factor, I don't want everybody to go out, check their blood pressure, and be alarmed today if it reads a little bit high. What we're talking about is the impact of high blood pressure over time, over several years on your cardiovascular system, rather than a particular reading today because you're nervous about COVID-19.
Yeah.
And then I'd like to take this opportunity to just remind everybody, continue taking the medicines that your regular doctors have prescribed. Those are the things that are going to keep you healthy and limit the impact of COVID-19 if you were to contract it.
Great, thank you. Thanks for the question, Barbara. Next question comes from Grace. I'll handle this one because we kind of did talk about it earlier. If a person's under mandatory quarantine order, how is the county monitoring that person and their family members? A nurse from the county health department does visit that person twice a day, do individual checks on the person, including temperature, symptoms, and seeing if they have any social support needs. How are they with food? How are they with family contacts? How are they with any job related issues that we might be able to forward on help for? In addition, we do also do unplanned visits. Again, I talked about compliance. Compliance is essentially a voluntary, but it will be compelled. I mean, there is a penalty for non-compliance, but generally speaking, we for the most part, everybody in the county who has been under quarantine has been compliant with that, and we appreciate those. If you're watching, that was you. We appreciate your compliance with that, because really you're saving lives by doing that. You're saving, you're controlling the spread. That's why you are under quarantine. You're controlling the spread. Next question also comes from Grace. When the time comes to open the county or the state again, what steps are being put into place so that caution and informed practices will still be upheld? There's certainly a chance for resurgence. That is definitely a concern of ours. I think when I say us, I mean county government, local government, but also the medical profession, the nursing community, and state governors, the federal government, all the way through. Everybody involved in this is the concern would be opening up the county, the state, the economy to the pre-COVID normal, and doing that too soon. So I think that's a collective concern for everyone. When we do open up, kind of what parameters will be in place, I anticipate sort of a graduated return to normalcy. So that will be, certain individuals coming back in certain percentages would be my guess. Maintenance of some sort of social distancing standards would likely continue. Additional testing would have to be part of the mix. There was an antibody question. I think that would have to be part of the mix. A vaccine on the horizon, that would have to be part of the mix. But generally speaking, diligence, vigilance, and cooperation and compliance would all have to be integral to any reopening. Any thoughts on that?
That is well said. I agree. I think that it's a gradual return to normalcy. I don't think that there's going to be a dichotomous, one day we're all practicing social distancing, and the next day everything's fine. That's just not how it works, and I think it's a process over time. Yep.
Okay. We did have a couple other questions on antibody. I think we pretty much covered those. And opening businesses, I believe I covered that. So Deborah has a question, and her question has to do with I might not be saying this right, but a pneumonia shot.
Yes.
If you previously had a pneumonia shot, does that lower your risk of getting COVID?
So the short answer is no. However, I applaud Deborah for getting her pneumonia shot. So the pneumonia shot, also known sometimes by the brand name Pneumovax, there may be some other brands out there as well, is a shot that's generally recommended for adults age 65 and over, as long as there's no contraindications. And what it is, it's a vaccine that prevents common causes of bacterial pneumonia, particularly pneumococcus, which is one of the more common bacteria that causes pneumonia. Unfortunately, this vaccine does not protect against COVID-19 in any way. What it would do is prevent you from hopefully getting COVID-19 and pneumonia at the same time. But unfortunately, there's just no vaccine out there yet that prevents COVID-19.
Great, thank you. Deborah also asked a question that quite a few other folks asked us, and that is about face coverings or masks. Kind of a hot topic. What are our thoughts on wearing it? Why is there recommendations around wearing it? I have some comments about the government regulatory side, but maybe on the medical side, if you could talk about the mask wearing and
Sure.
sort of the efficacy of that.
Absolutely. So the terminology that we're trying to use, our masks are generally what healthcare providers, public safety personnel, et cetera, are going to wear. And those are your medical grade masks, as opposed to face coverings and what have you, which is generally what's available for the general public. And those can be those homemade items, those can be store-bought, purchased, et cetera. The idea behind the face coverings for the general public is to prevent you, the wearer, from spreading COVID-19 to other individuals. So as I mentioned earlier, there may be a number of folks out there with very mild symptoms or perhaps little to no symptoms and don't realize that they could potentially be infectious in spreading this disease. And so by having a simple face covering, that limits the number of infectious respiratory droplets that may be coughed or otherwise spread to other individuals in your proximity. So there is a good role for it, and the CDC has a bunch of guidance on this.
And in addition to that, in New York State, essential employers were just, I guess effective tomorrow at 8 p.m., there's an executive order from a governor that dictates that essential employers are to make these available to their employees if they are in a role that's a public-facing, regular public interaction role and responsibility. So that's Executive Order 202.16. That's on the governor's website.
I would just jump in and add one more thing, which is wearing face covering is absolutely a great idea, but is not a substitute for social distancing.
Yes,
so we'll circle back to that, and it's not a free ticket to just go everywhere and congregate.
No, thank you for bringing that up. Deborah also asked, would it be a wise idea for every open store or business to take the temperature of each person before entering as a preventative measure?
So there is some validity to illness and temperature checks, if you will. So I can tell you that on the healthcare side of things, I have to fill out a survey every day before going to work, attesting to the absence of a fever, cough, respiratory symptoms, sore throat, muscle aches, etc. And obviously, if I were to have a fever, any of those symptoms, I would not be reporting to work. On the EMS and public safety side of things, we've implemented similar procedures. I would encourage any public-facing entity that interacts with the public in terms of your employees, making sure that nobody who's sick is working. Now's not the time where we want sick people at work. In terms of the logistics of how do you screen everybody entering a facility, that can be somewhat impractical and at times unsafe if you have a number of people sharing a thermometer, if you will, with no good way to disinfect it. And so I recognize that there's a fair number of impractical logistics that would go into, say, screening every individual entering a store. And really that's going to be up to the private individual business owner, if you will. But what we're really relying on is the general public to practice that self-monitoring that we discussed earlier. And just, if you're sick, please don't venture out into public.
Thank you. And also nursing homes as well are doing that. The county runs a public nursing home, a 266-bed facility in Mount Morris. We do temperature checks of all the staff entering, and actually on a regular basis once they are within shift. Another question, I guess I'll handle this one from Deborah, is there is so much information in the news and media, and much of it is contradictory or contradicting. How do we know what to believe? Well, I guess from my perspective is, where can we point you to what we feel are the best sources of impartial, unbiased, practical information that is in the public health realm? That would be the New York State Department of Health website. That would be the local county website. So livingstoncounty.us, right in the middle, you'll see the COVID image, and click on that, a bunch of resources, all of our news releases and all the resources related to anything medical. And also the CDC. The CDC.gov has a bunch of information as well. And then for anything to do with the pause, New York pause, what's an essential business, what's not, what can remain open, what can't, I would encourage you to visit the governor's website. So just look up New York Governor Cuomo, and off of there, you'll go to the ESD, Empire State Development website, and either of those should be able to give you the information that you need. Anything else on news?
I would just add that COVID-19 or not, it's always good practice to double check anything you read or hear, especially if it's not from an official source. Just always look for a second reference.
Yep. Okay. Next question comes in from Facebook, and this is from Michael. And Michael says there is good clinical data that shows hydroxychloroquine can be effective, potentially with lupus patients, other cases worldwide where this has been referenced. Obviously, this has been in the media. What is the county's Department of Health opinion on administering hydroxychloroquine with or without erythromycin? Did I say that?
Correct.
For treatment. I can tell you that the county is not has not kind of opined or provided any sort of official statement on that as a treatment or the efficacy of that treatment. As far as it being, standardized or available or related to COVID-19 measures, I guess I'll ask the doctor to opine on this one.
Absolutely. So this is a very controversial topic, and I will tread lightly. So hydroxychloroquine is an oral prescription drug, and you may have heard of it in terms of preventing and treating malaria. So if somebody was to travel to an area where malaria is endemic, they may be prescribed hydroxychloroquine to prevent contracting malaria. Somehow, and I'm not entirely sure how this got started, but somehow there was some suggestion that perhaps this might be an effective treatment for COVID-19. So there has been some very low-level literature suggestive that it could potentially be beneficial. And I'm treading that, speaking in those terms very intentionally. To date, to my knowledge, there has been no prospective randomized clinical control trial demonstrating a role for hydroxychloroquine, broadly speaking, among patients who are infected with COVID-19. If there's some low-level, perhaps suggestive data that it may be helpful, but that data is limited, why not just do it? Well, the problem is it's got side effects. It has some significant side effects. And there was a paper actually just released within the last week out of Brazil showing some significant cardiac side effects, some abnormal heart rhythms in patients who are taking this medication. So we may or may not be solving one problem and instead causing a bunch of secondary problems, particularly in somebody who's already sick and has low ability to compensate for those other problems. There has also been, unfortunately, at least one case report of a poisoning-related death in somebody who overdosed on hydroxychloroquine, attempting to self-treat COVID-19 nationally. So there is potential side effects. So we always want to be very careful before we start introducing risky medications, and we want to make sure that that benefit outdoes any potential risk.
Good, thank you. Very good question, Michael. Thank you, Dr. Farney, for the medical answer there. Testing comes up a lot. Particularly, as we mentioned earlier, how to get one, and has that changed a little bit? You're going to see a news drop today. I think it's already been released by the time we're live here, which is related to URMC Noise Health in partnership with the county, kind of doing some more availability of testing, what we call curbside testing. Obviously, check with your provider first. There's links off of the county website on a press release. Also, you can look up Noise Hospital. Either Twitter, social media to find information on that. So testing is kind of slowly, unfortunately slowly, expanding. But Carl asks, what is testing? So what does it involve, and how might one get results when they get a test?
Absolutely. So once a physician or other trusted healthcare provider is authorized to test, it's actually a fairly simple process that just requires a little bit of patience. So generally there's a Q-tip type swab that is inserted into the nostril or the nair, into the nose. And it's actually a deep nasopharyngeal swab. So it goes back in a little ways. It is somewhat uncomfortable, but I can assure you it's fairly brief, and most people do just fine with it. So that sample, which is taken from the upper respiratory passages, is then put into a test tube, which is then taken to a lab that's able to run testing for COVID-19. So as I mentioned, the number of labs and ability to run these tests are expanding. Currently, most of those tests are likely being done in the Rochester area. So that test actually has to be couriered to the lab that can take it. And so that process can take hours to a day, et cetera. Once that test is received, there has to be the ability to run it on that machine. So sometimes there may be a little bit of a backlog and they're getting through them as fast as they can. They do a specific test called polymerase chain reaction, or PCR. And essentially what they're looking for is genetic material from that virus. If that is detected on the test, the test is positive, which means you have the disease. The ordering provider or institution, in some cases, is then notified of that positive test by the lab. And then it's up to that institution or ordering physician provider to contact the patient. That whole process, I can tell you when these tests were first sent to Albany, that process was taking days to a week. Now, most of this is happening within 24 to 72 hours, which is a marked improvement, so that the time interval has shortened.
Thank you. Great question, Carl. We got it from a few others, Matt and Lisa as well. So thank you for asking that question. It's on our mind as well. Next up, I just want to say the guy behind the scenes here, the Martin Scorsese of COVID-19 YouTube live Q&As, Sean Rooney, has alerted me to the fact that on the description here at some point in the screen, you'll be able to see the website link for the COVID-19 page in Livingston County. So the one I'm referencing, that URL somewhere down there, so you can take a look at it. Next question comes from Doug, and Doug wonders why older adults, so why are older adults and those with chronic health conditions at higher risk?
Great question. So older adults or those who suffer from several chronic health conditions may have a somewhat weakened immune system, if you will, and as a result of that are less able to fight off infections such as COVID-19. And again, not everybody's the same. So if there's someone out there who's 68 years old and ran a marathon a month ago, their immune system is probably going to be a little bit more robust than a younger person with 15 or 20 underlying medical problems. So everybody's going to be a little bit different. I would also say that having chronic medical problems does somewhat tax your cardiovascular system and your lungs and make them less able to compensate in the setting of an acute infection.
Great, thank you. Next question comes from David, and David asks, will there be a COVID-19 season much like the flu season?
So unclear. As I've said before, because this is a novel coronavirus, it's only been around, as I said, for about 4 months in humans. We have about 4 months of data. So talk to me in 12 months and I'll have a better answer for you. But we've seen similar coronaviruses in the past with the SARS outbreak in 2003 and the Middle Eastern virus later on. And to my knowledge, those things haven't come back on a seasonal basis, but we just don't know yet. So to be decided.
Good. There is a question. I think we have it here somewhere, but I guess we'll go over it now. It's related to flu, so I figured we'd hit this one now. And that is, Rachel asked it, and David had a second question related to it. Why is COVID-19 more of a concern than the flu if the flu kills more people?
So very astute question. Early on, when COVID-19 was first hitting the headlines, the message we were sending out was, remember the flu, because at that time, flu was much more prevalent in our communities. I just got the latest numbers on flu in our community, and within the last week, there have been 0 laboratory confirmed cases. So flu has essentially not necessarily completely disappeared, but it has at least gone back into hiding for the time being. And so right now, the primary concern is COVID-19. People presenting with influenza-like illness at this point today are far more likely to have COVID-19 than they would influenza. But the concern, we in the back of our mind, we still need to think about flu, and especially next season. October's not that far away. There is hopefully a summer in between, but as fall approaches, we need to be vigilant and go back out and get our influenza vaccines just as we should every year.
Thank you. And we talked about, for those that watched our first episode with Jennifer, Public Health Director, that issue was coming up a lot. And we talked about that there is no vaccine for the COVID-19. There is a flu vaccine, seasonal flu vaccine. Yep. The lethality or mortality rate right now of the COVID-19 is a far greater percentage than the flu. I think it's maybe a 10 times factor.
Correct. That is correct. Yeah.
So it has a 10 times a greater chance to kill someone who contracts it. And the spread rate or the infection attack rate is much more pronounced
Correct.
with the COVID-19.
So this particular virus, as Ian said, is aggressive, and it does make people sicker. But I will broad numbers, roughly 80% of people who contract COVID-19 have mild illness and do just fine. It's only about 15 to 20% that require hospitalization, and it's only about 5% that end up very ill. So the overall number of people who are ill is low, but if a lot more people get the disease, that means that there will be more of that category of ill patients.
Great, thank you. And thank you for that question, Rachel. Next question comes from Fran. What do first responders do to stay safe? I know Dr. Farney is our EMS medical director, as he stated in his intro. He's kind of always in touch with that community. So if you could talk a little bit about that, the safety of our first responders.
Yeah, absolutely. So there's a number of things that first responders, including EMS, fire, law enforcement, et cetera, are doing to keep themselves as well as the general public safe. So first and foremost, they're doing all those good things that we talked about, social distancing. They're staying apart, washing their hands, practicing good hygiene. They're not coming to work if they're sick, so that we're not spreading this disease out in the community. In terms of if you interact with public safety personnel, or for some unfortunate reason you have to have EMS come into your home, in terms of what to expect, they're going to be masked. They're going to wear masks. We're doing that on every patient encounter at this point. They're also going to have on some type of eye protection, typically safety glasses. You might see goggles. And they're going to have gloves. In certain circumstances, they're going to additionally gown up, put on a medical gown for an added layer of protection. So there's a number of things that you can see and expect from your first responders, but it's going to be otherwise the exact same expert care that you've come to know and expect here in Livingston County.
Great, thank you. And to follow up on that, we have a great community of first responders. Somebody asked a question. They are very passionate about this, even just seeing the first response community in action in regards to this pandemic. And they asked about volunteering. So I'll answer that question. Your local fire, ambulance, EMT group is always looking for volunteers. So definitely contact your a local district or local department to inquire about volunteer opportunities. I'm sure they would be very interested to talk with you. But really just a plug here, take a second here to make a plug for the first responders and also the nurses, all of the clinicians, the doctors, the people that are kind of at the front lines of the response from a medical side of things. We want to thank you from the bottom of our hearts at the county government and really show our gratitude and appreciation for all the work that you're doing. So thank you. The next question, I have a couple more left, so thank you for joining us. My name is Ian Coyle. I'm the County Administrator in Livingston County. I'm joined here with Dr. Aaron Farney, the EMS Medical Director. We have the next question, I believe, from Bruce, and that question is, how does COVID-19 affect the lungs?
Great question. So as I've said before, everybody's a little bit different. For the majority of patients who contract COVID-19, their lungs won't be impacted in any clinically significant way. There are a smaller subset of patients who can develop some acute problems within their lungs from COVID-19. Typically, what we're seeing is what appears to be fluid in the lungs, likely in response to inflammation from the virus. When that fluid gets inside the lungs, it can cause problems with exchange of gas and oxygen between the air in your blood. And that can cause some problems oxygenating your cells, your organs, your tissues, etc. So when we see that, sometimes folks need some supplemental oxygen and hospitalization, if you will, until they're better. But the vast majority of folks, it's a mild cough, some mild symptoms.
Okay. Great, thank you. And we're going to talk a little bit about lung capacity in a second. We got a couple more questions on that. We did get a few questions. Mary Beth, Carol, Mike, and Phil were very interested on intimacy with their partner. And as I'm going to say, this is Dr. Farney and not Dr. Ruth. So we're going to pass on those ones respectfully. The next one we are going to move is to Jennifer. And she asked, what is a ventilator? How does it work? There was a couple other things on this question, but basically we hear a lot about ventilators, federal government, state government. We need more. How many do we need? What does it do? Who has them? Who doesn't have them? But what is a ventilator? How does it work?
Great question. So at its most basic level, a ventilator is an artificial lung, if you will. So it pushes air in and out of your lungs through a plastic breathing tube. So before being put on a ventilator, someone would essentially be put into what it amounts to a temporary coma. They would have a plastic breathing tube put into their lungs and then connected to a ventilator. Now, the reason that someone would be on a ventilator would only be if everything else isn't working and we're not getting enough oxygen to the blood into the tissues and organs. And there's really no other way to do this. So this is sort of a last resort, and it's that very small subset of patients. Ventilators first kind of came about back in the polio epidemic decades ago. They've come a long ways since then. If anybody's seen pictures, if not, look it up online. They used to be iron lungs that people had to be inside of, and that they would push air in and out of the chest wall. Now they are much more sophisticated. They're typically electronic and operated by computer chips. They have a multitude of complex settings that can be titrated to an individual patient's needs, including how fast it's working and how much oxygen it's supplying, how much pressure and volume, etc.
Great, thank you very much. We did get that a few times, so hopefully that answers the other questions we got on ventilators. I guess maybe our last one is also kind of dealing with machine and technology. Kyle asks, is it safe to use my Cpap machine? Can a Cpap take the place of a ventilator?
Great questions. So if you've been prescribed a Cpap machine, absolutely continue to use it exactly as prescribed. It's been prescribed for a very good reason. Hopefully people aren't doing this, but please don't share your Cpap units. Obviously that would be a vector of transmission if somebody was sharing that. I doubt anyone's doing that, but please don't start. Also, if you are ill, so if you have infectious symptoms, fever, cough, shortness of breath, and you're prescribed a CPAP, you should continue to use it. But CPAP in particular can do something called aerosolization, which means it can put some of those viral particles into small aerosols in the air. So the numbers I've seen on this is anywhere from a few inches to a few feet that those aerosols can spread. So the reason I bring that up is if you're ill and you have infectious respiratory symptoms and you're using CPAP, you should be isolating, if at all, to the extent possible, in a separate room from anyone else to avoid spreading that disease. The second question was, can a CPAP replace a ventilator? Not really. What a CPAP can do in some circumstances for folks who are having acute trouble breathing in the emergency department, if you will, is potentially prevent the need for a ventilator and give us time to reverse the underlying medical condition. So that works particularly well for people with acute heart failure, asthma, or COPD. It's unclear if it works very well for COVID-19. Unfortunately, there hasn't been a lot of data to suggest that CPAP has been able to replace or stave off ventilator use for that subset of patients who are very ill. But a CPAP is essentially one level pressure, whereas a ventilator would be multiple levels of pressure. So it's not quite a replacement for a ventilator.
Great, thank you. That wraps up our Q&A today for Ask the Doctor session on COVID-19. Before we wrap up, any concluding comments from Dr. Farney?
I would just like to, first off, thank you for inviting me to be here. And then thank you all for listening, paying attention, and staying informed. I hope that everybody out there is staying safe, washing your hands, practicing good hand hygiene, and we will get through this.
Thank you very much. Another plug for the census. Please complete your census. We're in third place. Nobody likes being in third or second. We would rather be in first place. So let's get there in Livingston County and the region. I want to thank Dr. Farney not only for joining me today, but thanking him for the work that he does, regionally for us on a regular basis, and for the great work that he and other healthcare practitioners and those in the medical field are doing each and every day to respond to this crisis, protect you, protect the vulnerable, protect those that need it in that kind of first defense. So I thank you for that. Kind of a virtual fist bump. I can't shake your hand. And then thank you to everyone that was watching today. We're hopefully going to be doing this again in the near future. Do your part. Stay home. Stay safe. Stay positive. Wash your hands. Practice social distancing, and check our website for future updates. Thank you.
Thank you.
Perfect.